Hi, my name is Dominic and I'm the Director of Operations for Inspiral Health. It's an unfortunate reality that crises can occur at any time, seen or unseen. Pandemics, by their very nature, are a rising tide disaster, and therefore are not fully declared until the spread of the infectious disease has taken hold and is sustained in one country and in another WHO region. This is phase 6 of the WHO's 6-stage classification for determining pandemics. Therefore, pandemics are not always recognised as early as they could and should be, with preparation and response being affected by this fact. Many countries will be unprepared and, due to the rising tide nature of the pandemic, worse still, ill-prepared. Despite the obvious evidence and warnings, in most disasters affecting a significant population size, there are well recognised and documented psychological problems and effects that occur after catastrophic disasters. When these large-scale events occur, survivors are often left with significant and long-lasting psychological problems, such as grief crisis, PTSD and depression. Many disasters causing large-scale adverse impacts and associated psychological disorders are caused by sudden impact disasters, and as such little warning is given. However, a pandemic will start remotely for most countries, as there is always starts in one single place, leading many to not be directly affected to start with. This can lead to a widespread lack of action, and many assuming the infection will not impact on them directly. In addition, countries may overstate their emergency preparedness and again underestimate the spread, scale and impact on their population. This effect can cause populations and governments to move from novelty initially, to concern, to anxiety, and then to panic, rapidly following the spread of the virus to secondary populations globally. This effect can overwhelm many responders and governments and preparations, leading to poor initial decision making, exacerbated by the impact of the psychological impact of the pandemic. Therefore, it's vital to understand this effect and to plan sufficiently to avoid this initial period and its adverse poor decision making, affected by the significant psychological impact on decision makers alone. Personal protection equipment standards must adopt a maximum protection protocols until strong scientific and medical evidence allows for the relaxation of PPE, personal protection standards. It's vital that this approach is undertaken to both protect healthcare workers and to the wider public, both from direct infection and from spread in health and care establishments. Equally, it's also vital to understand that there is potentially more than one mortality at peak associated with pandemics. Personal protection equipment, or PPE standards, must adopt maximum protection protocols until strong scientific and medical evidence allows for the relaxation of those PPE standards. This is vital that this approach is undertaken both to protect health and care workers and to protect the wider public, both from direct infection and from secondary spread in health and care establishments. Equally, it's also vital to understand that there is potentially more than one mortality peak associated with pandemics. The first peak is associated with the direct transmission of infection from the pandemic pathogen itself. This may occur in waves, however, it all remains part of the overall first mortality peak. The second is associated with the suspension, cancellation and reduction of normal health and care services caused by the impact of the pandemic on staffing, resources, health and care establishment, and in particular specialist services like cancer and transplant. This should be avoided through the introduction of the separation of services, with non-pandemic patients being protected throughout by having the allocation of resources and shielding of those resources to provide their services throughout the pandemic. This will ensure that the second mortality peak is reduced. Immediate consideration must be given to full barrier care in all health and care establishments. However, also, within the wider public, universal precautions such as mask wearing and hand washing should be introduced early. Alongside this, early introduction and implementation of lockdown, where services and activity that are not vital to life and social distancing measures are introduced to contain the overall spread and reduce transmission. Organisational preparation has been shown repeatedly to fail in pandemic crisis, Yet early action will reduce the overall impact and spread rate, allowing time for treatments and a potential vaccine to be developed.